Most people think of genetic testing as something that pregnant moms have done to see if their babies are at risk for genetic diseases like cystic fibrosis or Down syndrome. While that is one reason for genetic testing, more and more people are having this testing done to check their own risk for a disease or figure out the best approach to treating a disease that they may already have. Joining me now is Melanie Korbman, a certified genetic counselor with Cancer Treatment Centers of America. You know, this whole concept, Melanie, of genetic testing, I think, is a really fascinating one. Who should get it and why?
We do genetic testing in people that we think may have been born with a risk to get cancer. So these are usually people, there are certain red flags that we look for. A woman who may have been diagnosed with breast cancer at a young age 45 or under. A woman who may have been diagnosed with breast cancer in both of her breasts. Any woman who's been diagnosed with ovarian cancer, if there's both breast and ovarian cancer in the family, or somebody who has a strong family history that's suggestive that there may be a hereditary risk in the family.
Oftentimes you hear the term genetic testing and you think, oh my goodness, it's really going to be so invasive. What is the testing actually like?
The testing actually is a simple blood test. We take a small amount of blood, 2 to 3 tablespoons of blood, or very often if we're just looking at one gene, we can do it with a saliva sample.
Now, we have also heard in terms of with breast cancer, the BRCA gene.
Right.
And so explain to us, what these different genes are, how they manifest themselves, and when they would manifest themselves.
So with the BRCA genes, these are the first 2 genes that were discovered that cause a very high risk to get breast cancer. They were discovered in 1994 and 1995. Usually these genes are protective for us. Everybody has these genes, both women and men have these genes, and normally they protect us against getting cancer. It's these genes that recognize that there's a cancer cell and kind of put the brakes on that cancer cell, don't allow it to make more copies of itself. If our body's natural brake system isn't working properly, that's why the cancer starts.
And so, let's say you have the test, you find out you're positive for a certain gene for a certain disease. Then how does the genetic counseling process kick in?
So I meet with a woman, I'll tell her what the risks are for her to have this genetic mutation. Once we find out that she has the mutation, say in the case of Angelina Jolie,
yes,
she knew that her mom had had ovarian cancer, she had genetic testing and found out that yes, she did test positive. She knew she had an 85% risk to get breast cancer sometime during the course of her lifetime. So she didn't want to be that woman who woke up every morning thinking, is today the day I'm going to get breast cancer? She made the decision to have prophylactic mastectomy, and that greatly reduced her risk of getting breast cancer.
And so the genetic testing can help you identify what the real risk factors are,
exactly,
and then what the options are.
Correct, correct. We can help women have options and make decisions this way. Some women choose to have screening for breast cancer. They would start at age 25 and start their mammograms and breast MRI and go to the physician twice a year and have their breasts examined.
Great information. Melanie, thank you. Thanks
welcome.
very much. So for more on genetic testing in the Cancer Treatment Centers of America, you can go to cbsphilly.com and click on the Talk Philly. We're coming right back.